Good day everyone, I'm Nasa Jane Itabieras and my topic is about control of non-communicable disease. Now, let us know first what is non-communicable disease. So the term NCDs, it refers to a group of conditions that are not mainly caused by an acute infection. It is the result in a long-term health consequences and often create a need for long-term treatment and care. So this includes the conditions of cancer, cardiovascular disease, diabetes, and chronic lung illnesses. In 2015, non-communicable disease or NCDs accounted for 68% of all deaths in the Philippines. So the figure from 2015 showed that every third Filipino or 29% can die before the age of 70 years from one of the four main NCDs, which is the cardiovascular disease, diabetes, chronic respiratory disease, and cancer. That is according to WHO 2017. Now let's proceed to the NCDs and risk factors. We have two kinds of risk factors. First, the modifiable behavioral risk factors, and the second is the metabolic risk factors. But now let us discuss first about the modifiable behavioral risk factors. So modifiable behaviors such as tobacco use, physical inactivity, unhealthy diet, and the harmful use of alcohol are all increase the risk of NCDs. So now let's proceed to the tobacco. Tobacco is the findings from 2015 global adult tobacco surveys indicate that 40% of Filipino men and 23% of all adults 15 years older are currently smoke cigarette. That is according to Epidemiology Bureau Department of Health 2015. And also, almost 1/5 of adults or 19% or 13.1 millions are daily smoker. That is include 34% among men and 40% among women. And the great concern is that 12% of school-based adolescents, which is 13 to 15 years old, 18% of boys and 7% of girls are current smokers. That is according to Philippine Global School-Based Student Health Survey 2015. And we have also the second-hand smoke, which remains an issue in the Philippines. An estimated 22% of adults or 3.6 million adults were exposed to tobacco smoke in close. So for attributable NCDs, it includes multiple forms of cancer, ischemic, heart disease, stroke, and other cardiovascular and circulatory disease. We also have the chronic obstructive pulmonary disease and pneumoconiosis and peptic ulcer disease. We also have diabetes, cataract, macular degeneration, and rheumatoid arthritis. So next we have the alcohol. So WHO's Global Status Report on Alcohol and Health indicates that per capita alcohol consumption in the Philippines is 6.6 liters per year. Men are estimated to consume 6 times as much alcohol, or 11.3 liters per capita as women. And that is according to World Health Organization 2018. So the 2015 Philippines Global School-Based Students Health Survey revealed that 18% of students or 13 to 15 years old currently drink alcohol, and almost 57% of students had their first drink of alcohol before age of 14 years. So with boys, they're more likely to have drunk alcohol before 14 years old than girls. That is according to Department of Health 2015. For the attributable NCDs, it is include multiple forms of cancer, pancreatitis, epilepsy, diabetes, and ischemic heart disease, stroke, and other cardiovascular and circulatory disease. Now, let's proceed for our last modifiable behavioral risk factors. We have the physical inactivity. So, it is one of the leading risk factors for NCDs in the Philippines. In 2015, an estimated 43% of adults were not sufficiently physically active. So that is according to Food and Nutrition Research Institute, Department of Science and Technology 2015. And furthermore, women are more frequently physical inactive, which is 53%, than men, which is 30%, especially to those living in urban areas. So for the attributable NCDs, it is include coronary heart disease, type 2 diabetes, and breast, and also we have the colon cancer. Now let's proceed to the metabolic risk factors. So metabolic risk factors are contribute to a 4K metabolic changes that increase the risk of NCDs. So we have the raised blood pressure. We also have the overweight or obesity, and we have the hyperglycemia or high blood glucose level, and lastly we have the hyperlipidemia or high levels of fat in the blood. Within the Philippines, 31% of adults are overweight or obese. So these figures are higher for women than for men. We have the 35% for women and 27% for men are overweight or obese. That is according to Food and Nutrition Research Institute, Department of Science and Technology 2015. We also have an estimated 19% of adults older than 18 years, 20% of men, and 18% of women have raised blood pressure. That is according to WHO 2018. National Nutrition Survey indicates that 19% of adults older than 20 years had raised total of cholesterol in 2013 versus 14% in 1998. Cholesterol among adults or 20 years and over has been rising in the past 2 decades. That is according to Food and Nutrition Research Institute and Department of Science and Technology 2015. And lastly, a total of 5.6% of adults age over 20 years and 5.8% of men and 5.4% for women have raised fasting blood glucose. That is according to Food and Nutrition Research Institute, Department of Science and Technology 2015. Now let us know how to control the non-communicable disease. So first, we have the reduce the major modifiable risk factors tulad nung kanina, mga tobacco use, harmful use of alcohol, unhealthy diets, and physical inactivity. Also, we need to develop and implement effective legal frameworks, and we need to orient health systems through people-centered health care and universal health coverage. And lastly, we need to promote high quality research and development. And here we also have policies and treatments to reduce NCDs burden. So we have the National Multi-Sectoral Plans and a Department of Health strategic actions plans for NCDA preventions and control. We also have the tobacco and alcohol taxation. It is the 2012 Republic Act 1035-1, also known as the Tax Reform Law. So it is an act restricting the excess tax of alcohol and tobacco products and its proposed amendments and revisions, and also have the 2017 Republic Act or Tax Reform for Accelerations and Inclusion, or what we call TRAIN. So it is to ensure that the government is able to provide for the needs of those under its jurisdictions and care through the provision of better infrastructures, health, education, jobs, and social protections for people. We also have the package of essential NCD intervention, or PILWIN. So this is a tool to assess the risk factors of the patients through timely screening and to determine the level of risk to CVD. So this is done through interviewing the persons to have a clear medical history and getting their blood pressure and blood sugar level and body mass index. And now we also have a PhilHealth primary care benefit package for NCDs. And of course, we have the provision of NCD maintenance medicines under the Medicines Access Program of the Department of Health. And also we have the policies on cancer prevention and control, including palliative and hospice care. And now we have the Stop Smoke mobile health program, together with a quiet line and smoking cessation clinics. So here, smoker who wish to quit may call on a number hotline of 165 and 364, or simply text the Stop Smoke to 29290 or 165 to 354. So services offered are free within Metro Manila, and currently two PLC together with the DOH are working towards enabling free mobile services to areas even outside the region. And we also have the Philippine Plan of Action for Nutrition 2017-2022, which addressing stunting, overweight, and obesity. So that's all for my discussion. Thank you for listening, guys. See you again, and goodbye.